So first and foremost, what I'm going to show you here, this is a cleansing bottle. Some people call it a peri bottle. I'm not sure how others may call it, but what have you, it is a bottle. This is what I was given to from the hospital the first time I had a baby. So this bottle is basically to help you reduce any discomfort or sensation when you're peeing. So what most people do not know is that after you have a baby, going to the bathroom can be a little bit uncomfortable. Yeah, you do have this burning sensation going on, like some stinging sensation when you go to the bathroom after you have a baby. And so this bottle right here is very, very necessary. What I didn't know was that you have to use it the same time as you are peeing, basically. So you want to fill this bottle. It doesn't matter, you can fill it to the brim, you can fill it halfway, whatever you prefer. Just fill it with a warm water just from the tap. And when you are going to the bathroom, when you're peeing, use it the same time as you are peeing. Just spray it, push it however way, and use it the same time as you're peeing. You want to use it from front to back. This is to help reduce discomfort from any burning sensation, and also to prevent any kind of bladder infection, because you want to keep that area clean. And it's also helpful if you have any form of vaginal tear when you have a baby. Some people call it, another word for it, episiotomy. Like for me, I did have minor tear when I had my baby, so they had to stitch that up. And the good thing with those stitches is they melt on their own, so you don't have to go back for them to remove it or anything. But because of those stitches, you want to take care of it so the wound can heal and heal well and as quickly as possible. And so, and to prevent, like I said, to prevent any form of infection, it is important that you use this bottle the same time as you are peeing, because it can be painful when you have like a pee, which was more like salt water going into any kind of wound in that area. So this will help you a whole lot. So mamas, remember to keep this on hand when you are using the bathroom after baby. And the next thing I want to talk about, this is basically just using any kind of a cooling substance or cooling. I would say it can be a cooling spray. It can be the witch hazel pads or tucks. Some people, that's what they call it. Or it can be any kind of ointment or foam that helps reduce the discomfort around the area after you have a baby. So what I'm going to show you here is a pain and itch spray that I got from the hospital. So I think this is mostly hospital supplies, so I don't know if you can really find them in the store, but you can definitely find something similar. And what I don't have right now is the witch hazel pads or tucks. This is something that was provided to me from the hospital. I'm out of it, unfortunately, but this is something that you can find in the stores, in the grocery stores, in the pharmacy, anywhere you go. These are just like cooling pads. It's called witch hazel pads or tucks. You really need them on hand, especially after you have a vaginal birth. And basically what you do when you go to the bathroom, so the first thing is you pee and you wash the pee area with this peri bottle. And after that, of course, I did explain that you'll be bleeding at the same time. So you're going to make sure you have a clean sanitary pad anytime you go to the bathroom, or anytime you feel like, oh, the pad is filled out, you need to change it. Just make sure you have a clean pad on at all time. So what you basically do is you grab a pad and then have one of these, or the witch hazel pad, whatever the ointment, just spray on it, or you can, like I said, if you have the pad, you just put one or two. You can do 2 or 3 or more, however way it works for you. You just place them on the pad and you put it in the under area. This is some form of cooling sensation for the area, especially when you have a tear or after you have a baby, when the place is very tender and very sore. That helps cool it a lot. Oh, you feel way better when you do that. Some people I've heard of cooling pads that are put in the refrigerator just to have it cold, to provide that cooling sensation over there. So, I mean, I just went with what the hospital gave me and I used what I had. So, these are different ways just to help with the cooling of the area. And of course, another thing that I wanted to talk about is you want to cushion any seat or any chair that you sit on. Just make sure you put on a pillow or something soft. You can just put blankets or whatever just to cushion the area, because sitting can be a challenge, trust me, or anything that just makes you comfortable so you can sit very well. Alrighty. So the next thing that we're going to talk about, this I feel like is a highlight of my video today. So do not miss on this. Stay tuned. Hi, lovelies. This next section here, I want to talk to you guys about what I use to help promote quick healing of my vaginal area, especially after I have a baby. So in the hospital, they do teach you a lot. They give you informational packages, discharge notes that tells you a lot about what you can do when you go home to help promote healing. So what I'm going to show you is what I did personally. I'm not pushing it on anybody to do that, but this is what worked for me, and I felt like it will be good or be a great resource to share with everybody, especially when you have a baby and you have a lot going on with you. So here is what I'm going to share. So first and foremost, this is Epsom salt. So this is what I use, drop to teals. So I'm not promoting any brand. It's just Epsom salt. Just helps relieve any aches and body pains. It can be any Epsom salt that you have on hand, but this is what I use. So basically with the Epsom salt, what I did was I had a bucket. So I'm going to show you the bucket I used. So this is it. This is a big long bucket, but it came in handy because what I did with this bucket was that I filled it with hot water. So the hot water, you can boil it on the fire, you can use a kettle, you can use whatever just to boil some hot water. I did half full of this bucket, and then so I put it, like I'm gonna show you. So basically I did 1 cup of the Epsom salt. I put it in the bucket first, and then I added my hot water in there, just half full, like I said, because what you really need is the steam that comes out of the water. So another thing that I'm going to show you here is a towel. You're going to need a towel. So this towel, I folded it this way so you can see how I did it. This is only to give you some cushion on the edges of the bucket because it can be rough after some time. So this, I put it around the edge of the bucket so I can sit on it and get some cushion under my tush, to give me some comfort under my butt. Because after you put the Epsom salt in your hot water, what I did was I put this towel around the rim or the edges of the bucket so I could sit on it to have a feel of the steam. And mind you, you're going to use hot boiling water. So the hot boiling water, the essence of it is basically to get the steam to enter the body, and especially the vaginal area. So what I didn't tell you about is what you're going to do is you're going to sit on this thing butt naked. Okay, so you're going to be sitting on it basically butt naked because you need that steam to enter that area. Your vaginal area, like I said, is going to be sore, it's going to be tender because that place is basically bruised, traumatized from the baby push and all. So you need it to heal and go back to its normal size or normal look. And so this is a traditional method that my mom showed me. This has been passed on 2 generations, so it's a cultural thing. If you're from anywhere in Ghana, you're probably familiar with this. And I don't know about other countries. I don't really know what other people really do. But this is more of a traditional thing that goes on in people's home, especially people that have babies, and then to help them heal faster and quickly. So after you put this water in here and you sit on it, you can sit on it anywhere from 30 minutes to 1 hour, or some people can go longer. Mind you, as you sit on the steam or on this bucket, the water gets cooler because you've exposed it to regular room temperature, so it's going to cool down with time. So you can judge it, and depending on how long you sit on it or however way you feel that you sat on it, you can just be done with it after an hour or two, or maybe even less. So that being said, this promotes blood flow to the area, which is very much needed to increase the healing process, and just make you heal faster. In other words, this is what they tell you at the hospital. So they tell you to do a sitz bath, and this is what the sitz bath is about. Is basically put in about 6 inches of water, warm water, in a bathtub, and then they tell you to sit in it, to soak in it. No soap, no bubble bath, nothing at all. Just sit in it, just to get the water flow to the area, to increase the healing and promote, like I said, quick healing. And so this is basically the same concept if you think about it, even from the reverse, is basically teaching you the same thing. So for me, I just thought about it like, okay, the moment you have a baby, you're bleeding. You have a lot going on. You have blood clots and other stuff that's coming out of your body. So to sit in a bathtub or in a sitz bath with a pool of blood around you, that can be a little, awful, if not challenging for me. So this was an easier method. It was I feel like more of a logical and reasonable way to do it. But like I said, it's your choice. Either way, hey, you're going to be healed after some time. It gets better. That's something you should know. It definitely gets better. So that was what I wanted to share with you guys, my personal experience. But we'll be talking more about what you need for this journey for after you have a baby, like your postpartum course. So just stay tuned, and I'll bringing you more. Hello again. So the next thing that I want to be talking to you guys about is basically how to manage pain after you have a baby. So the one thing that you want to avoid is any kind of straining or pushing when you go to the bathroom, because hey, you're gonna feel a little bit of constipation after you have a baby. That is normal. So what I do recommend is you have a laxative or a stool softener on hand. The most common thing to have is basically a stool softener, because you don't want to be straining. We want to avoid any form of hemorrhage, any hemorrhoids that could result as a because of straining, or due to constipation. So you want to avoid that. And most of the pain medication that you're put on after baby has a side effect of constipation, and so it is important to have some kind of stool softener on hand, just to treat and prevent any form of constipation. So what I suggest is either a stool softener or a laxative can be good to just either prevent or treat constipation. And also for your pain medication, I was only given ibuprofen. I think ibuprofen 800 milligram. Some people, it depends. Like, I guess it depends on the kind of pain that you go through. There's some are given, a few courses of narcotics, which is opioids, just to help treat the pain. So something like Norco. So if you are given any kind of prescription medication, I feel like just use it at a bare minimum, like when it's really necessary, like when it's really needed, when you feel like you're in very much extreme pain. That's when you go for those strong pain meds. Other than that, you can use ibuprofen as needed also to help with the inflammation here and there. And especially if you are breastfeeding, I feel like if you're breastfeeding, your go-to will probably be either ibuprofen or Tylenol, just to help with the pain. Because with the stronger pain medications, those can transfer into the baby's breast milk, and you don't want to do that. You don't want to get baby too drowsy. You don't want to, get baby on some high pain meds would that could result in some fatal issues. So ibuprofen, Tylenol. I mean, if you don't tolerate ibuprofen very well, Tylenol can also be good, just to help with the pain or discomfort that you might be experiencing. Sometimes you go through a little bit of cramping here and there because you do have some black clots that are coming to being discharged out of your body and all that. So it's important to have some pain meds on hand, and also important, like I said, to have the stool softener, laxatives, and all that as well. And lastly, what I want to talk about is resuming exercise. I know how some moms, they want to get active, get back into shape, which is very important. But right after you have a baby, hey, just know that you are a champion. You are a big champ. Your body has gone through a whole lot. Just give it time for it to heal. Just know that it's going to go back to its normal, but it would just take time. So process the whole thing. It's okay to move around, get your movement here and there, your steps here and there, but don't do too much. Yeah, do not do too much, because I did that and it wasn't fun. It just wasn't fun after I tried to do too much, because I was like, oh, I pushed out a baby. I think I can do just about anything. But no, hey, take it easy. Use as much help as you can. If you have your husband around, family, just have them help you as much as you can, because taking care of baby is a big deal, because they are going to go to sleep, just know that, and it will just be left with you and baby at night to take care of her, him or her. So yeah. And the other thing I want to tell you guys about is, just try to avoid strenuous activities right after you have a baby. Stretching, straining, doing all sort of heavy stuff, vacuuming, doing a whole lot of dishes, standing, running, going around. Take it easy on yourself. If you want to lift anything heavier, the most you can go is your baby. Don't lift anything heavier than baby. And exercises can be resumed as needed. As you feel like your body is healed, just go back to it. Yeah, but also don't lie down in one place, in one position for very long, because it's fairly common to experience clotting issues, especially after you have a baby. Just try to do the bare minimum, move around and get your blood flow going. But that's it. But I want to hear what you guys have to say about this video. You want to share, comment, like, subscribe to this channel. Like I said, I'll be bringing you more every Wednesday, so stay tuned. We're going to talk more. If you have any comments, just put it in the comment box if there's anything that you would want me to discuss or really emphasize or talk more about, especially concerning this process, regarding the postpartum course. Just put it in the comments here below. I'll be more than happy to do that. But for now, coming your way next, stay tuned, and I'll bring you more as we go. I love you guys. Take care.